Hello and welcome to today's WorkSafe Month webinar, Sedentary Work and Public Health, Integrating the Evidence and Identifying Potential Solutions. I'm Stephanie Morawski from WorkSafe Tasmania and I will be your moderator. Before we start, please take a moment to read the following slide about information received today. I'll now go over housekeeping. Here is a screenshot of the attendee control panel. You should see something that looks like this on the right hand of your screen. You're likely listening in using your computer's speaker system by default. If you would prefer to listen over the phone, just select telephone in the audio pane and the dial-in information will be displayed. Webcams and audience microphones will not be used in today's webinar. Questions will be taken at the end of the presentation. Please use the questions pane on your control panel to type and submit your questions. Finally, today's webinar is being recorded. I would now like to introduce your presenters, Professor David Dunstan from Baker Heart Diabetes Institute and Associate Professor Genevieve Healy from University of Queensland. David is the head of the Physical Activity Laboratory at the Baker Heart and Diabetes Institute in Melbourne and is a National Health and Medical Research Council Senior Research Fellow and Baker Fellow. His research focuses on the role of physical activity and sedentary behaviour in the prevention and management of chronic diseases. Genevieve is a National Health and Medical Research Council Career Development Fellow at the Cancer Prevention Research Centre in the School of Public Health at the University of Queensland. She is the lead investigator on the BeUpstanding program of research, a program aiming to support workplaces to stand up, sit less and move more for their health and well-being. Welcome, David and Genevieve.
Thank you, Stephanie, and thank you for this wonderful opportunity.
Thank you, Stephanie. Thank you.
Okay. And yeah, welcome all, and wherever you are. I'm down in Melbourne where we're still working from home, but fortunately I'm able to work at a height adjustable workstation, which, as you can see by the title, is something that I'm really passionate about and wanting to see more activity in this space to overcome the ill effects of too much sitting that occurs across the day, and in particular in the workplace. So it is a great pleasure that I share this presentation with a close colleague and a good friend of mine, Genevieve, who's up in Brisbane. We've arranged this presentation in two parts, where I will initially present some background information about why we need to really start to think about the hazards of too much sitting and what's the impact on the human body. And then importantly, and I think this is a really interesting area, because Australia is really leading the way here, is to start to look at some of the identifying some of the potential solutions to the problem of too much sitting in the workplace. And Genevieve will highlight a wonderful national initiative called the BeUpstanding program that's really starting to translate the research evidence that we've generated and putting it into practice for many people around Australia. So I just thought it would be important to kick off with a bit of scene setting and to present some background information. And I want to hone in on an area that both of us work extensively in, and that is chronic disease, and really highlight that Australia has a major issue with chronic disease. And this is data presented from the Australian Institute of Health and Welfare back in July this year, where they've presented that chronic disease is one of Australia's biggest health challenges. What do we mean by chronic diseases? There's a host of chronic diseases, but these are the common ones, such as arthritis, asthma, back pain, cancer, cardiovascular disease, pulmonary diseases, and diabetes, and mental health conditions. Why is this important? Well, what is known is that more than 11 million Australians have at least one chronic disease, and perhaps more alarmingly is that 1 in 5 adults actually has multiple conditions. And if you consider the personal costs, but also the economic costs of chronic disease, it's substantial and a huge imposition on the current healthcare budget. Now, thinking about the implications of chronic disease for workplaces, and this is data, it's a little bit old, going back to 2009, but it's data from the Australian Institute of Health and Welfare again. And I've summarised some of the key points that came out of this publication, which was looking at chronic disease and participation in work. And the AIHW identified that chronic disease, as I've presented in the previous slide, affects 1/3 of working-aged adults. And importantly, people with chronic disease are 60% more likely to not participate in the labour force. And if we think about those with chronic disease, they average nearly 1/2 day of 1/2 day a week absent from work during each fortnight. So the other aspect is that, and it's not surprisingly, that older workers are twice as likely to have a chronic disease compared to the younger age. Apologies, we've lost some of the text there. So there's some key points there that chronic disease is a major imposition in workplaces. This is not just localised to Australia. The World Health Organization has identified that the big 4 of non-communicable diseases or chronic diseases are represented with cardiovascular disease or heart disease, cancers, respiratory disease, and diabetes is an area in which both of us have worked extensively over the last decade or so. Importantly, the WHO also identifies that there are some unifying risk factors, and the modifiable risk factors, these are the ones in which can be changed through improved lifestyle, include tobacco use, not surprisingly, harmful use of alcohol, unhealthy diet, and physical inactivity. So that's not undertaking a sufficient amount of activity throughout the week to improve one's health and fitness. So these have been identified for a number of years, right back to 2014. But with the emergence of increased automation at work, increased working hours, the interface with computers, increasingly we're starting to observe that another risk factor, a modifiable risk factor, is the problem of too much sitting. And if we now know that Australia is actually identified as a nation of sitters. And before I highlight, how much time people are spending sitting, I think it's really important that we separate, and this is an issue in our physical activity research field, in identifying what do we actually mean by sedentary behaviour. What this is showing is that physical activity occurs across a spectrum. Here is virtually lying down in bed at night, right up to the higher levels of energy expenditure, and this is up at the vigorous intensity type of physical activity. The goal is that we are really shifting people to want to undertake a more moderate to vigorous physical activity. When it means METs here, this is just a metabolic equivalent, meaning the amount of energy that's at rest is typically 1 Met. And so, as you can see here, at the lower end of the physical activity spectrum of sedentary behaviour, we're marginally just above what's called a person's resting energy expenditure. Of course, this is 6 times higher when we undertake vigorous intensity activity. And one key definition that has emerged in the last 5-10 years is this definition of any waking sedentary behaviour being any waking behaviour characterised by not only the energy expenditure being really low, but undertaken in a sitting, lying or reclining posture. And we know that these behaviours can occur across multiple contexts, from in the workplace, in commuting, also in the domestic environment and during leisure time as well. So it's a really important point that we make here of sedentary behaviour is really at that low end of the physical activity spectrum. So it's been amazing over the last 10 years or so, the number of studies that have been undertaken to identify the evidence base linking too much sitting to poor health. And we really have progressed this science by getting better with our measures, because in the past we have relied on self-reported measures of sitting time and physical activity, which, as you are aware, can be subject to some large-scale error and measurement error. We've progressed because we are able to use activity monitors called accelerometers over here. Accelerometers measure how fast a person is moving. Every 15 seconds, it's collecting how fast that person has moved throughout the day, so we can identify if they're moving at a fast pace or a moderate to vigorous pace or a light intensity. The other device that we are increasingly using is this device called an active PAL or an inclinometer, which is worn on a person's thigh. And what this can do is definitively tell us whether that thigh position is in a horizontal position or whether it's in a vertical position. And of course, it's also got an accelerometer. So we, back in 2011, as part of a national study called the AusDiab study, we had a subsample of participants who we put these 2 devices on, one on the thigh, one on the worn on the hip, and we asked participants to wear this for 7 consecutive days. Now, this is presenting the average of the time spent in a waking day. So typically that's around about 16 hours if you account for 8 hours of sleeping. What we have observed, and I just focus your attention on the red here, is that the average adults in this age group of 35 plus spent 9.2 hours sitting as detected by the thigh-worn inclinometer. And importantly, when we break down those sitting, sitting duration, this is hours spent in what we would call prolonged sitting. That is periods of sitting that last for 30 minutes or more. So this is nearly half of the time is spent in what is called prolonged sitting. So a lot of hours spent sitting. And then the only other thing that I want to highlight here is that a very small period of time, just over half an hour, is spent in what is called moderate to vigorous physical activity. And remember, this is where most of our public health messaging is directed at, this small blue piece of the pie. And we really need to now start to look at the, the large sections of this pie and increase movement more frequently throughout the day. The other aspect that we have been really investigating in our data and others elsewhere is that it's not only a consideration of how long a person is spending sitting throughout the day, but also how they accumulate their sitting throughout the day. And what the inclinometer allows us to do is to start to identify different patterns of sitting between individuals. And you can see here with the white being sleep and the waking hours with the coloured sections here. These are two people from the Odds data set who have nearly identical sitting time, total sitting time throughout the day. But you can see there is quite a distinction between this person who we would call a prolonger and this person who we would call an interrupter. This person is accumulating their sitting in large sections of time. You can see here there's multiple hours here spent sitting with very little light activity and virtually none, little moderate intensity activity. Now, in contrast, we have a person that is still accumulating a lot of sitting, but they're frequently breaking up their sitting with interruptions involving light intensity activity and in some cases moderate intensity activity. And the evidence indicates that this pattern here of an interrupter is more favorable for many health risk markers like overweight and obesity, and also blood glucose and triglycerides and blood pressure. So it's not only an issue of the total time, but how a person accumulates their sitting time throughout the day. I'm just going to now summarize the evidence. And as I said, there's been multiple studies that have looked at relationships of high amounts of sedentary time to health outcomes. And this is perhaps the greatest synthesis that has been undertaken for the update to the 2018 US Federal Physical Activity Guidelines, where they essentially reviewed every single piece of information that has been generated so far and to identify what's the level of evidence for an association and also whether there's a dose response. Here's the outcomes, health outcomes that have been summarized. And I think the key point here is to highlight that compared to those who are sitting for lower amounts, those who sit for higher amounts, there is strong evidence now linking that high sitting to all-cause mortality, mortality from cardiovascular disease, increased risk of developing cardiovascular disease, and an increased risk of type 2 diabetes. So we now have a very strong evidence base showing relationships. The other thing just to highlight here, at least for all-cause mortality, the associations of too much sitting appear to be most pronounced in people who are also not undertaking enough physical activity, those who are inactive, really highlighting that we need to focus extensively on those who are high sitters, but also are physically inactive. And often in our field, we have had questions directed at us about, well, what's the role of getting your daily exercise? Does that cancel out the hazards of too much sitting? And this is a study that attempted to address this question. It was published in The Lancet back in 2016, and really has been an important paper in our field because it harmonized data across multiple studies of nearly 1 million people. Now, the important thing to note here is that this data I'm showing you here is based on self-reported data. So people reporting how much time they spend sitting and how much time they're physically active. Now, remember the question that we're asking is, if you do high amounts of physical activity, does that cancel out the hazards of too much sitting? This is a relatively busy slide, but what these authors did is create categories of physical activity. Now, up here is at the high end of physical activity. This is nearly 3 times the amount of the recommended amount. And of course, down here is the low amounts of physical activity. And in each category of physical activity, they created categories of sitting time from low amounts up to high amounts. Now, The key take-home points from this study is, of course, those that are not doing or barely any physical activity have a higher risk than those that are doing higher amounts. And of course, the more you sit, the higher the risk, particularly in those who are physically inactive. What's important to note here is that this category is what we would consider the current recommendations of 30 minutes of physical activity a day, and highlighting that increasing levels of sitting, even in those who are meeting the current physical activity recommendations, there's what we would call a dose response going, lower risk up to higher risk with increasing amounts of sitting. The other take-home point here is that at the very high levels of physical activity, this is the 3 times the current recommended levels, it appears that the hazards of too much sitting are essentially cancelled out, meaning that we need to either get people to work towards getting up to these very high levels of physical activity, or to focus on getting them to be more active, of course, but also reduce the time that they spend sitting. So at the moment, it appears that you have to do very high levels of physical activity to cancel out the hazards of too much sitting. And this was represented in a heat map that was generated by the authors, showing that, of course, when you're highly physically active, green is the preferred, that you have a really low, quite a low risk, especially if you sit for small amounts. But the converse is true for those that are virtually doing no physical activity, but sitting for higher amounts. But what the authors really highlighted was that, the issue really lies in those who are physically inactive and also sitting for higher amounts, as indicated by the red and the orange and yellow here. And we've taken this a little bit further, taken this heat map concept and applied a risk matrix based on sitting time, by simply asking people how much time they spend sitting, and also asking people how much time they spend physically active. And as you can see, this is like a classic risk matrix used in cardiovascular disease, etc. That the highest risk is up at no physical activity and high amounts of sitting. And of course, we strive to work towards getting down to a lower risk by increasing physical activity and reducing the time spent sitting. So what I've presented there is a fairly solid evidence base showing that high amounts of sitting is associated with increased risk. Most of the studies that have been reported have looked at total amounts of sitting time. And if we focus our attention on workplace or occupational sitting, there really isn't as extensive evidence base that exists for the total amounts of sitting time. And we published a systematic review. Now, this is 10 years old now, based on the studies that had been conducted up to 2010, that had specifically looked at occupational sitting and health risk with a number of these chronic diseases. And just to walk through here, the evidence is not so strong for when we specifically focus on occupational sitting. Some have observed positive associations with cancers, but when they look at this over longer periods of time, there's no association. Conflicting results for cardiovascular disease, no association with diabetes. For adiposity or obesity, half the studies showed a positive association, whereas longer-term studies have shown no association, and no association with mortality. What we did highlight here is that it was really quite challenging to investigate this, because studies had used all sorts of different methods of assessing occupational sitting. And one key aspect is that when most studies have essentially pooled all workers into their analysis, so could have had people who are working at a desk base and also those that are working trades in the analysis, which can really affect the associations that are being studied. And we've taken this a little bit further in recent times using the National Health Survey data. And to highlight this point, what we have taken is the question of looking at sitting at work and waist circumference. And this is a cross-sectional study, but what we did observe was that longer sitting time at work was associated with an increased waist circumference. But this was observed only in the desk-based workers. So importantly, what we wanted to do was look at the relationships in those that are working in the traditional workplace, desk-based work versus non-desk-based workers. We did not observe any associations with waist circumference in the non-desk-based workers, which is fairly intuitive if you think about it. When we looked at those in desk-based workers and did a little bit more of a stratified analysis, we observed that the associations were stronger in men than in women. And of course, the associations were observed in those who were physically inactive, which talks to the previous slide that the effects of too much sitting is most pronounced in those who are also physically inactive. Okay, so just to, I've presented the evidence base showing that too much sitting is associated with a number of health outcomes. But what is our understanding of the impact of too much sitting? How is this occurring? And we talk about the mechanisms. And again, there's been a lot of studies that have looked at the mechanisms and basically can be summarized into a few distinct implications of too much sitting. One's affecting the blood vessels and the blood vessel wall, lending them to be more have increased stiffness and thickness. Body mass, of course, increases with increased sitting. Effects on fitness, effects on blood pressure, and effect on blood glucose control and blood lipids. Now, this is a busy slide, but this is another slide that we've just recently presented to look at, well, what are the effects of transitioning from sitting for long periods throughout the day to sitting which is interrupted. And what we observed is that there's an increased blood flow to the brain, reductions in blood glucose levels, improvements in the blood vessel function, increased blood flow, reduced restriction, and of course we have observed that blood pressure is lowered through transitioning from sitting to a broken up or interrupted state. So a lot of benefits from just simply avoiding prolonged sitting. And now, as I want to lead into Genevieve's presentation, which is talking about potential solutions in the workplace, I want to draw your attention to something that we wrote nearly 6 years ago for the Medical Journal of Australia, where we took the time to look at the evidence and to put forward a perspective that we try to, a call to action to employers and doctors to start to recognise and respond to the health hazards of too much sedentary time. And the key points that we presented here is that, well, our argument was that the systems of work commonly observed in contemporary settings or offices demonstrates a high likelihood of excessive sitting hazard, particularly in those desk-based workers, and that the degree of harm associated with this hazard is likely to be substantial. And since that 2014, the evidence base has gathered substantially. And the evidence is quite well known. There are available ways to minimise the risk by changing from a prolonged sitting state to an interrupted sitting, and the costs are likely to be proportionate to the risk. And this then led to an approach from Safe Work Australia to myself and Genevieve and a number of others to really start to review the evidence across the occupational setting. And this was a publication back in 2016 where we attempted to look at sedentary work. And the concluding statement from this was that there is currently a rapid growing evidence base, increasing public awareness, widespread exposure, and growing advice from various authorities suggesting it's time to consider addressing the growing hazard of occupational sitting. And Safe Work Australia identified that sedentary work was an emerging occupational health and safety issue. So I think what this first half of the presentation has done is present the background and the evidence base showing that too much sitting is likely to be hazardous to health. But I think what's more important for us that are working out there in the field is to start to think about, well, if it is a problem, how can we fix that problem or identify solutions to that problem? And I'm now going to hand over the presentation to my colleague Genevieve, who's doing some wonderful work in identifying solutions in the workplace. Hand over to Genevieve.
Thanks, David. That was a really nice rationale for why we should be addressing too much sitting. But as you flagged, what are the potential solutions to this problem? Well, the solutions are relatively simple in concept. If you can, make sure you get up regularly. We recommend at least every 30 minutes. And where possible, try to make those breaks an active break. So walk to get some water or do some simple resistance activities at your desk. We recommend aiming to spend less than half of your workday sitting. But even just starting to make the change from 95% down to 85%, for example, will help to make a difference. But if these solutions are so simple, then why do we sit so much? Why have we turned into a nation of sitters, like David was highlighting? Well, just consider these two environments. One is open plan with movable furniture, colourful furniture, and creating different working options. And one is not. Think about how much staff activity levels might differ in these environments. Think about the impact on creativity, engagement, productivity, retention. Ask yourself, where would you rather be working? Our sitting and moving behaviours are driven by so much more than just personal choice. There are multiple influences that impact on these behaviours, and some of them are so subtle we may not even realise that we are being influenced. The physical environment is one example here. When there is well-lit, aesthetically pleasing and easily accessible stairwells, and the lifts are not in sight, then you're more likely to subconsciously go up the flight of stairs. However, if the lifts are the first thing you see and the stairway is hidden behind closed doors and with emergency access only signs, you're probably more likely to push that button. Workplace culture or norms around sitting and moving is another really strong influence on behaviour. Is your workplace one where people are up and moving about regularly? Would people feel comfortable standing and stretching during a meeting? What would colleagues think if they saw someone regularly leave their desk or schedule in a regular exercise break when working from home? To identify potential solutions, it is important to consider and address these multiple influences on behaviour. Another really key element to consider is awareness. Sitting is habitual and occurs across multiple settings. It is a behaviour that we typically do without thinking. As such, it can be hard to change as we fall into our normal routines. Indeed, 64% of employees in our BeUpstanding survey agreed or strongly agreed with the statement of, I need prompting to remember to sit less at work. And this was actually the biggest barrier to being able to sit less. Not equipment, not being too busy, just not remembering. And although humans have always sat, the health impacts of prolonged sitting are only recently becoming realised in the general population. Thus, it is also important to raise awareness about the impacts of too much sitting and the potential benefits of sitting less. A solution we have developed to help workplaces address the emergent work health and safety issue of prolonged sitting is BeUpstanding. BeUpstanding is a team-based program designed to support workers to sit less and move more for their health and well-being. This free program uses a train the champion approach to help workplaces raise awareness about the benefits of sitting less and moving more, and build a supportive culture in order to create sustainable change. It is designed for teams of desk-based workers, whether they're working in the office, at home, or a mix of both. The program has been based on over a decade of research into what works to support workers to sit less and move more. It has been developed in collaboration with policy and practice partners from across Australia, including Safe Work Australia and Comcare, as well as state-based partners, Queensland Office of Industrial Relations, Vic Health, and Healthier Workplace WA. We went live with the toolkit in September 2017 in a soft launch and collected data from over 100 workplaces. We then used the data from these early adopters to modify the toolkit to make it ready for a national implementation trial that we're currently running. The program continues to improve through a product development cycle based on the feedback from these multiple stakeholders. The program messages are to stand up, sit less, and to move more. So it is not about standing all day, but rather regularly shifting between postures and listening to your body. A slogan that we like to say is the best posture is the next posture. It is also not just about sit-stand desks. Rather, it is about raising awareness and creating that supportive culture for change across the whole work team. BeUpstanding is delivered by a workplace champion. This can be anyone in the workplace, but ideally it is someone who can communicate both up and down, is passionate about health and well-being, and is confident to be the role model for change. We've also found that our champions often have a great sense of humour. The BeUpstanding program uses the train the champion model to support the champion to take up, deliver, and evaluate the program using the familiar plan, do, and review format. The champion is guided step by step through the process with the toolkit providing all the materials and resources that are required. The program is designed to run for 8 weeks with staff. Our early data is showing that champions spend, on average, nearly 3 weeks in the plan phase, 9 weeks in the do phase, and just under 2 weeks in the review phase, so there is wide variety around this. The time spent per week in each of the phases roughly equated to 2 hours per week in the plan phase and 1 hour per week in the do and review phases for the champion. Again, there was wide variety around this. Like all health and wellbeing programs, it is essential that there is strong management buy-in for the program. Resources, including a business case, a sample policy, and a Dear Boss letter, are included in the toolkit to help with this management buy-in. It is also important that managers walk the talk and contribute to the discussions, as well as role model the desired behaviours. Staff input is critical to the success of the program. So as part of the planning phase, staff are asked to complete a needs assessment. This provides the champion with information on the team's current self-reported sitting, standing, and moving behaviours, as well as the desired level of what these behaviours are. BeUpstanding aims to bring the desired closer to the actuality. The needs assessment also captures what staff perceive as barriers to being able to sit less and move more, as well as strategies that they're currently using. This data is used to inform the staff workshop. Here, the aim is for the whole team to collectively decide on 3 strategies to sit less and move more that best suit them as a team. This participative approach is intended to build team cohesion and a supportive culture for the change. Teams are encouraged to choose strategies higher on the hierarchy of control if possible. So using elimination strategies such as voice recognition technologies, or substitution redesign strategies such as having standing meetings or centralising printers and bins. By teams choosing how they are going to be upstanding, it recognises that every workplace is unique and the team are the most informed about what is going to work for them. Here are some examples of strategies that teams that have participated in BeUpstanding have chosen to use. Some of these are from teams that have come on after COVID, and you can see how the strategies are applicable for the home working environment. Indeed, all of these strategies can be adapted to be used at home. So for one example, one team is using a buddy system to help with the support for change by holding each other accountable. Another is addressing the importance of prompting for behaviour change by setting reminders to move regularly. The sedentary smasher is a great way to think of a substitution strategy, and also a great way to try a number of different strategies. It is also excellent to see the strong demonstrated support for taking active breaks and not being chained to the desk in the home environment. Of note is that in addition to the 3 team level strategies that work teams choose to be upstanding, individuals may also choose to do other sit less, move more strategies that work for them. We developed a set of new resources to add to the toolkit to support workers at home following the COVID pandemic, and these are now freely available from the website. One simple team-based strategy is to have, as part of your remote or online etiquette, that you support standing movement during meetings. This can be formalised as part of a standard agenda or integrated into your online assets, or it can be as simple as demonstrating the behaviour yourself or acknowledging and supporting when others have been active. So, for example, I'm standing and doing some calf raises right now while talking to you. And I hope you are also taking the opportunity during this online webinar to take a postural break. Since going live in September 2017, we've had over 670 workplaces unlock the toolkit, exposing over 46,000 staff to the stand up, sit less, move more messaging. Participation has been from across Australia, and we've been thrilled to see the uptake from the large number of regional sites, with every dot on the map shown here representing one of our BeUpstanding teams. We've had participation from all industries and a good distribution across organisational sizes, from small to very large. As part of the sign-up process, champions were asked, what are you hoping to achieve by your work team taking part in BeUpstanding? The most common themes that have emerged so far are around improving health and reducing prolonged sitting time, with many champions combining these elements. For example, they wanted to encourage sitting less and moving more to support health and wellbeing. Other champions touched on improving knowledge around the health impacts of too much sitting, improving work outcomes such as productivity, and creating a supportive team culture. What was interesting was the changes that we saw post-COVID, with more workplaces seeing BeUpstanding as a way to increase social connectedness and draw the team together. These findings help to really highlight the importance that wellbeing programs have during these really uncertain times. We're currently conducting a national trial to understand in more detail the uptake, implementation, and effectiveness of the BeUpstanding program, as well as the costs of the program. But preliminary signs are really positive. On average, staff are reporting a 9% drop in their workplace sitting time, or a reduction of about 43 minutes per workday, which is a level that has been associated with the health benefits that David was flagging earlier. We are seeing good benefits in terms of musculoskeletal symptoms, with a reduction in the number reporting any symptoms, as well as a reduction in the level of discomfort for those who do report symptoms. And interestingly, despite the impacts of COVID, and perhaps reflective of the lower levels of flu circulating, we're seeing considerable reductions in sick days following the program. These are all self-report data, and the findings are preliminary, but they are looking very promising. What is also great to see is that staff are reporting positive impacts on the components that the program is specifically aiming to address, namely team culture, knowledge, attitudes, and awareness around sitting less and moving more. Importantly, in the BeUpstanding program, it's not just the research team that gets access to the findings. Champions get real-time access to reports that they can use to demonstrate the impact of the program, as well as the costs associated with program delivery. This is designed to help them support the business case for sustained change. In terms of costs, our very early findings are showing that the majority of teams do not spend anything extra on the program other than their time, which is great for encouraging wide-scale uptake. Teams are encouraged to run the program on a yearly basis, building on their successes to continue to work towards a culture where sitting less and moving more is the norm. In addition to the surveys and audits that champions do as part of the program, we're also conducting interviews with them to understand in richer detail their experiences with BeUpstanding. Here is a testimonial from one of our champions, Danielle, who was a champion for their small business team in Toowoomba in Queensland. As you can see, she was really supportive of the program, and she reported strong uptake of their chosen strategies within her team. This team finished the program in December last year, and we'll be following them up really soon to understand the maintenance of their behaviours and strategies and any potential impacts of COVID. So just to summarise, the key points from David and myself. Australia's ageing population and growing burden of chronic disease will have impacts on the workplace. Too much sitting has been identified as a risk factor for chronic disease and has been identified by Safe Work Australia as an emergent work health and safety issue. The solutions for sitting less are simple in concept, but require consideration of the multiple influences on this behaviour and strong support and role modelling from management and peers to help enable sitting less and moving more to be the new norm. The free evidence-based BeUpstanding program is designed to raise awareness and start the culture change to help your work team sit less and move more for their health and well-being. I'll finish up with a call to action for anyone interested in being part of a world-first research trial. As flagged, we're currently conducting a national implementation trial of BeUpstanding. By taking part in the trial, champions get access to free expert health coaching. We're particularly seeking desk-based teams from small business, blue-collar sectors or call centres. If you are interested or want to find out more, you can contact us via the BeUpstanding email or by the website. And of course, anyone can sign up to BeUpstanding at any time. So even if you're not able to take part in the trial, you're still helping to contribute to the evidence base that is informing policy and practice. Thank you so much for listening, and David and I look forward to addressing any questions that you have.
All right, thank you, David and Genevieve. And yes, to the audience, please submit any questions that you have for our presenters today. Professor David Dunstan from Baker Heart and Diabetes Institute and Associate Professor Genevieve Healy from the University of Queensland. Please use your questions pane to type and submit your questions. So Genevieve, in your presentation, you talked about using systems such as Microsoft Teams to put in reminders to be upstanding and getting moving. An audience member has asked, however, is there a program that can be downloaded to the computer, preferably a free one, that can remind you to move every hour, but will also suggest some activities, stretches, strength activities to do?
There are programs available. I don't have the specific names of programs, but we have written some blog articles. So what I didn't flag is that the BeUpstanding site also runs a blog site that collates all the latest evidence and gives hints and tips and tools. And there is a specific article just on this around potential brake software. It is probably about trying different ones and seeing what works for you. I don't know one that does that double feature so well, the download prompt plus do a stretch, but there's certainly some nice ones that are quite easy to do.
All right, thanks, Genevieve. A question, has much research been done to address sedentary behaviour for those working in the transport industry, for example, bus drivers?
Yes, transport industry where it was identified. Oh, sorry, David, you can go on.
No, you go. Sorry, Jen.
They were identified as a high-risk group, as well as desk-based workers. In terms of our research, we have focused initially on desk-based workers as they're the largest occupational sector, but there are other researchers that are looking at the transport industry. As you can appreciate, it is a bit more difficult because you don't have as many opportunities to take breaks, but colleagues who are actually part of the BeUpstanding team, Associate Professor Nick Gilson, has been working with the transport industry on strategies for truck drivers and how they get to be more active. So there are programs out there. They're not at the stage of the evidence or the translation of evidence that the work is for the desk-based workers yet.
And I think just to add to that, it's a really interesting question, because if we think about the field of physical activity, the very first studies highlighting that physical activity was of benefit for health came from a classic study of the London bus drivers, where they were compared with the conductors of the bus. And of course, the conductors of the bus were moving around a lot more frequently up and down stairs of the double-decker buses, whereas the drivers were sitting for extensive periods. And it was quite clear that the drivers had a 2- to 3-fold increased risk heart disease compared to the conductors. So some of our earliest pieces of research actually comes from the transport workers.
Thank you, David and Genevieve. What are the benefits or disadvantages of having an adjustable sit-stand desk? And do you have any recommendations for how long you should be standing and how long you should be sitting for?
Well, the benefits of it is that you can change your posture when you want to change your posture. So you can work in a sitting position and you can work in a standing position. And it makes it really easy to alternate between postures. In terms of recommendations, it's really about listening to your body. So what things that I flagged before is to try to get up at least every 30 minutes, but we're also not saying for standing for hours unless you've worked your body up to be able to do that. So if you're just starting out, then trying to get up regularly, so just even up for a few minutes to start with, at least every 30 minutes, that's a really good start. And you'll find that you'll build up that time, but standing for too long in a static posture isn't great either. So all of our messaging really is about shifting between postures. And the nice thing about sit-stand workstations is that they allow you to do that while continuing to work.
Yeah, and I think the other thing to add to what Genevieve's highlighted there is that the evidence showing that the height adjustable workstations is beneficial for reducing workplace sitting has really come from studies that have provided an educational component along the lines of what Genevieve was just talking. So not just handing over the workstation and saying, oh, there, go for it. Extensive educational processes were undertaken, and I think that's one clear message that we would like to get across, is that there really needs to be some form of an educational process about what Genevieve was talking, is of avoiding prolonged periods in a standing and also a seated position.
Yeah, and that's the nice thing about BeUpstanding. A number of teams have come on board. You do not need a sit-stand desk to take part in BeUpstanding, but it's a very nice complement if you do have sit-stand desks, and particularly if you're finding that your workers aren't using them, because it adds that educational element, it adds the culture change element. Because if you just put the desks in there, you don't let people know why you're putting them in or any recommendations around them, and you're not encouraging a culture change where it's normal to see people getting up and down and moving their desk up and down. It's not likely that it's going to work, and that's what our research has shown. So that's the really nice thing about BeUpstanding, is that it's this free program that helps complement environmental changes like sit-stand desks.
All right, thank you. And it's still time to submit any questions to our presenters today, Professor David Dunstan and Associate Professor Genevieve Healy. Via your questions pane on your control panel, please type and submit those questions. So a question that has come in: sedentary behaviour and physical inactivity aren't well understood by the general public and often used interchangeably. Do you have any clear public health messaging on identifying the differences and solutions? For example, the active couch potato concept.
Yeah, this is a great question, and thank you for that, because our field, the physical activity field itself, has been in a state of a confused state over the terminology here, because, as rightly pointed out, the term sedentary behaviour and physical inactivity have been used interchangeably. Where we're getting better is understanding that when we talk about physical inactivity, we are talking about not meeting the current recommended level of 150 minutes of moderate intensity physical activity per week. So a person can meet the current recommendations of 150 minutes per week, but also, particularly those working in occupations, desk-based type occupations, they can also sit for higher amounts of time. So this leads to that whole concept that you can be physically active, but also sit for higher amounts. And that's what has often been used as the term, the active couch potato. Higher, meeting physical activity recommendations, but sitting for higher amounts. I agree that we have a long way to go in terms of creating more simplistic or more simple messages of distinguishing these two. But I'm encouraged by recent recommendations here in Australia and also US and the UK, where they're adopting a message of sit less and move more often as a basic message to increase total physical activity across the day.
All right, thanks, David. Could you, either Genevieve or David, just comment on typical asymmetrical postures adopted when people stand still?
Genevieve?
So I've got my public health hat on, not my ergonomist hat. So, I mean, I'm not an expert in this field, and this would just purely be coming from my own observation of the different, if you're just standing still, you can often, slouch, put hips out. And there just goes back to, there's no correct posture that you should be staying in for any one long period of time. That's really the message that I want to continually repeat. So there's not an ideal posture for staying static in. So just keep rotating between those postures, whether it is sitting down, and none of the work we're saying is about cancelling sitting out of our lives. It's really about getting up and down regularly and being aware of how much you sit and how insidious, how much it's crept into our lives with the computerization and modernization that David was talking about before.
Yeah, and I think just to add to that is just as there are poor sitting postures, poor standing postures can occur, and I think this reinforces that message that we made before, is that an educational component is essential for identifying such poor posture in a seated and also a standing posture as we move towards the increased use of height adjustable workstation.
All right, thank you, Genevieve and David. Could a business be negligent if they're not promoting some type of initiative or program that allows the business to be not largely sedentary?
This is a challenging space, and I think we need to consolidate the evidence base even further, particularly as I mentioned about the hazards of occupational sitting with health outcomes is rather modest, rather weak evidence compared to total sitting time. We are aware of some examples of where organisations have had a person sue, but that's been extreme cases of where, for instance, in one of the cases, a person was required to sit for 16, 18 hours and more a day, working on a task where she developed a DVT and sadly passed away. Of course, that was in a US context, but I think that we really need to consolidate or enhance the evidence base before we can move a little bit more progressively into that space.
Thank you, David. Then just in closing, David and Genevieve, is any movement good, or does it have to be a high level activity?
No, the very simple answer is any movement is good for health. And in fact, what we do know is that we get our greatest public health benefits of taking people who are doing nothing to doing something. So standing up is good. Moving is even better.
Thank you, David. So thank you, Professor David Dunstan, from Baker Heart and Diabetes Institute and Associate Professor Genevieve Healy from the University in Queensland. And thank you everyone for attending today's webinar, Sedentary Work and Public Health, Integrating the Evidence and Identifying Potential Solutions. At the close of this webinar, you will receive a survey to complete. We appreciate you providing us with your feedback. This webinar has also been recorded and will be available on the WorkSafe Tasmania YouTube channel. On behalf of WorkSafe Tasmania and the WorkCover Tasmania Board, thank you for joining us. Thank you, David, and thank you, Genevieve.
Thank you,
Stephanie.